I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. As you know, this program focuses on different healthcare issues, programs, and services provided by KRMC that are going to be of interest to you and your family. So I hope you'll stay tuned because I've got a great guest on the program today. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Susie Rhodes, manager of the admitting department here at KRMC. Thanks for being on the show, Susie.
Well, thank you for having me, Jamie.
So let's learn a little bit about Susie first, and then
Okay.
we'll talk about admitting in the hospital and all that good stuff. But,
Okay.
So how long have you been in Kingman, Susie?
About 21 years.
Oh my goodness, you've seen some changes.
Yes, ma'am.
And what brought you to Kingman? How'd you get here?
Well, come from Southern California. My parents retired here a year
Oh.
prior.
Okay.
After coming up a few times over that last year, we decided, my husband and I, well, let's go check it out. And we've been here ever since.
Wow, so you raised your family here then, pretty much?
Yes, pretty much.
How old are your kids? Because they're grown up,
Oh,
right?
I'm going to tell my age.
Oh, well, okay.
Okay,
You just-
well, no, my son is 35 and my
Okay.
daughter is 25.
Well, see, you don't look that
So,
old, so.
thank you.
Yeah. So no one would guess. But so they didn't really grow up
No,
here.
they were
already-
pretty much.
Were they,
pretty much.
so they went to school in California? Did they come with you, or did they stay in California?
Well, Christopher went to school a little bit in California where his dad was,
Okay.
and then a little bit here with us.
Oh,
And
okay.
same thing with
With your daughter?
Christine.
Okay,
Yeah.
very good.
Yeah,
So I was
so-
just curious if they were
That's
in
okay.
Kingman or if they're out and about.
Oh
there.
no, they're Christine lives in Las Vegas with
Oh.
her two boys.
Oh, that's nice. They're not too far
and
away.
our son and his family are in Oregon now.
Oh, very good. So,
Yeah,
so Vegas is close. You can get there.
Yes.
It's
Yeah.
one of those good things sometimes to have family not too far. I mean, not
Right.
too close, but not too far either. So that's a
Right.
good thing.
I just miss the grandbabies.
Oh, I know.
Yeah.
It's hard when, no, personal experience,
yeah.
as we've talked about before. And so both you and your husband are employees of
Yes,
KRMC.
ma'am.
And how long have you worked here?
20 years,
Oh,
both
so
of
you
us.
started right after you
Oh,
moved here?
absolutely, yeah.
And have you been in the admitting department ever since?
Ever
I mean,
since,
from the
yes,
beginning?
I was hired back, I think it was 91, late
Wow.
90s, something like that, as an on-call admitting rep, and from
Okay.
there I went to the insurance verifier and then to the admitting manager's
Oh, wow. So
position.
you've been,
So I've
seen some different parts of it.
Absolutely.
From the administration kind of
Right.
side of it, the business side, if you would,
Yeah.
of the hospital day to day.
Yeah.
But that means you've seen a lot of changes at KRMC too.
I sure have.
Because I know, I mean, I've only been in Kingman 10 years, but I know in talking with folks who've been here a long time that, there was a time when, and we'll be honest, that KRMC didn't have the best reputation. People
That's
still
correct.
think of us as that community
Yes.
general hospital kind of thing, the county hospital.
Yeah.
And yet what's really fun, what I love is talking to some of the older folks that might have been here 30 years, when they came to the hospital
Yes.
then. And then they come now and they're just amazed at the difference. And
Oh,
I
yeah.
am so proud of KRMC and what we do, the level of care we provide and the service that we
Yes.
provide. So I'm sure you've seen that too.
Oh, yes. When I first started, I think there was 400 employees. Now
wow.
there's, what, over 12,
We're al-
1,500?
We're almost to 17.
17? Okay, yeah.
We're like at 16,
And
75.
I've
I
seen
think.
it grow.
Yep. it's
And yes, I
amazing.
think our reputation has grown. It's gotten a lot better. I mean, this is an
We have a lot
awesome
more
hospital.
doctors
And
a lot more
services that we provide. Absolutely.
Wow. So admitting, I mean, I know that people just assume that's the desk you go to when you first come in.
Yes.
But there's a lot of behind the scenes stuff that's involved with admitting. So
Right.
let's talk about that.
Well, we not only check you in for any type of service into the hospital, but we verify your insurance.
Okay.
We check on your copays, deductibles. We'll keep you informed of that while you're here in the hospital. Paperwork, Medicare patients. Medicare requires so much paperwork for a Medicare patient.
Right.
or a Medicare HMO patient when they come in. So we provide all that paperwork upon registration. So when you look at us and you kind of go, "You're kidding, right?"
We've got this stuff.
No, the paperwork has to be filled out.
Sure.
So we make sure all the forms, everything's in order so that your insurance is going to pay maximum benefits, everything's signed.
That's really important.
It is very
Makes a
important.
big difference
It is
if
very
you've got
important.
a $200 bill or a $20,000 bill.
Absolutely, absolutely.
Right.
And we can also now, we have some software and programs where we can check and find out if you have an insurance. Some people have an insurance they don't know they have.
Oh.
If that makes sense. Like some Medicare patients might come in and they don't realize that they actually have a supplement that they had signed up for at some
Long
time,
time
but
and
they
forgot
forgot
about it.
about it. Yeah.
Wow. Well, that's kind of
So
cool.
that's- yeah,
so you're
so
able
that's
to
cool.
search and help them with all
Absolutely,
that.
and help them with that.
Okay. Well, and now admitting, I mean, I know there's a couple of different parts of admitting
Mm-hmm.
too, because you have the front desk in the main hospital.
Yes.
And the ER side. And then,
Yes.
Okay. So what's kind of the difference between the two?
Between the two? Well, the main hospital entrance is basically where people can present when the doctor sends you from the doctor's office with your
So
orders.
it's kind of pre-planned.
Yeah, it's pre-planned. You show up, we know you're coming.
Like you're gonna
Okay,
have a
we've already
surgery
expecting you.
or-
Correct.
Yeah.
The
Some
ER
procedure
is when
done.
you present to when you have a true emergency.
Okay.
So you will come in, check into the emergency room. They'll do a stat reg, a quick reg on you, call for a triage, and then you'll go back and see the physician.
Mm-hmm.
Once the physician's treated you and made an assessment, then admitting will come in and we'll, at that time, update your demographics, ask for your insurance information, get your paperwork signed.
Okay.
So there's a big difference between
Well, absolutely,
the ER
and I think that's really an important part of that. I think it's important that people understand that because when you're in an emergent situation, the last thing you're worried about at the beginning is paperwork,
Absolutely.
right? So you guys
Absolutely.
step in at the right time after they've seen the doc, they know
Absolutely,
kind of more
yes.
what's going to happen. You're either going to get fixed and go home,
Right.
or we're sending you upstairs.
Absolutely, absolutely.
And then you work more with the family at that point and kind of figure out what's going on.
Absolutely, yeah. If the patient's not feeling real well, we'll have the family assist us. And again, it's just to obtain that accurate information on demographics and your insurance
Yeah, and then,
and get the paperwork
yeah.
signed.
Well, and I've always been impressed. There's been a couple of different situations we've had in the ER where, like, I've been back there because of the PR side of it, where we've had, like, the bus accidents and things like
Yes.
that. And you've got a emergency room filled with people.
Yeah.
And your staff, they just, you know, stay calm. They've got their clipboards and they just go patient to patient and figure out what's going on, get their information, which even from just the demographics of figuring out so we can report what happened and who's here.
Absolutely.
Because like the last one we had, that was the bus accident. And the biggest challenge with that was how some of the patients were here, some patients were up at Sunrise, or some of the passengers, and some were at UMC. And so these poor patients down here had no idea what was going on with their family members. And so we were working with those other two hospitals, getting names, conditions, so
Yes.
we could let families get reunited and put their fears at ease.
Right.
And your staff was awesome.
Well,
I
thank
just-
you. I was truly proud of them. You know,
Yeah.
there was a few of us there, and they just jumped right in, and they know exactly what to do
Yep.
in a situation like that. So I was very proud of
Oh,
them.
and then they just stepped in wherever else was needed, too.
Absolutely,
and-
yeah. We all just do what we have to do.
Yeah, I
no
think
matter
that's
what
part
it
of the
is.
culture
Yeah.
of KRMC, too. I would say the
It is.
majority of our employees that, you know, that's not my job description.
Right.
It's like, what do we need to do to get this fixed or to take care of it?
Right. In the emergency room, whether it's a bus accident or just normal,
Right, normal day-to-day
day-to-day
stuff.
My staff, they'll get you a warm blanket. They'll ask the clinical staff if you can have something to drink. We'll try to get the family something to drink. You know, so
Yeah.
I think it is. It's the culture. It's just the way we are.
Yep.
We're here to serve and take
Yep.
care of people.
Yep.
And
It's
go
just another
above
part
and
of-
beyond and provide that excellent customer
Yeah,
service.
yeah. So,
to
and it's
people.
really important, and I think that Well, like we talked about a minute ago, how when you're in the emergency room especially, well, and any time, truthfully, you come to the hospital, it's not usually for the best of reasons, right? I mean,
Absolutely, yeah.
As much as I love KRMC,
Yeah.
patients are not here for good things usually.
Right.
Unless the babies, I guess, having a baby. then.
Absolutely. And we try to use discretion in any registration department. If a patient's being admitted and we can tell by the diagnosis on the script, sometimes we'll just wait until the next day or later before we even bother the family, because we know you are upset. I know
Yeah.
how I would be if
Yeah.
my family was in here.
Right.
The last thing I would want is somebody chasing
Pushing
me
me
down
around
for
about my
something right now.
insurance,
Yeah.
right.
So we try to handle that as delicately and as professionally
Yeah,
as possible. But
right.
it is part of our job, and
Sure.
that is what we do.
Yeah. Well, and even those all that information goes into the medical record
It
that
does.
patient needs
It
at some
does.
point in time in the future when they come to the window. They want a record of what happened.
Absolutely.
You guys were there to get
Yeah.
that started.
And it does need to be accurate and
Right.
correct.
Yeah.
So
Now, speaking of records, so we're in the process, hospital is going electronic, the whole
Yeah.
electronic health record, the Sorian. Does that affect you guys?
no, not at this time.
Okay.
We are not really involved with Sorian.
So right now you're just inputting into the AS400
Well, the Med
still?
Series 4, yes,
Okay,
ma'am. Mhm,
okay.
Yeah.
And then, but at some point in time probably? or
At
so?
some point in time, I do believe that registration will be using Sorian.
Okay, so
Yeah.
they all will talk to each other.
Absolutely, absolutely. But for right now, yeah, we're still using the
Okay,
Med Series.
okay, that's cool.
Yeah.
So I know admitting, and we talked before the show, there's other things besides admitting that report to you
Right.
either directly or indirectly.
Right.
What else is that?
I have the PBX, the switchboard, main
Okay.
operators for the hospital.
Right.
They're my employees at Well. Those are the ladies, for the most part, that will answer the phone. Good morning, KRMC, how may I help you?
And so
Or-
that's when they call the main number, the 757-2101.
Absolutely. And they can
And direct them. They know
Absolute-
everybody.
Oh, they
I
do.
swear
They
to
know
goodness.
everybody. They've got their little cheat sheets. We even have some patients that will call up and they'll ask for the phone number for Walgreens. Well,
Oh.
my operators have it. Instead of telling them they have the hospital,
Yeah.
they just give them the number to Walgreens.
that's, again, that
so
customer
it's
service.
the customer service that they provide,
Right,
yes.
because there's a lot of time you call a business and ask them for another business's phone number. They're going to be,
Right.
hello, did I say I was?
Absolutely. But no, the switchboard operators are awesome. They've got
That's
all the
great.
doctors in the area, their numbers.
Oh, wow. So they have all that
transfer.
information kind of at their
Absolutely,
fingertips.
absolutely.
They can look it
And
up.
they do this every day so they can just whip those numbers right off the
Yeah,
top of their head.
yeah, I bet they do. So
Yeah.
now is the switchboard 24/7?
The switchboard is 24/7. However, after 11 o'clock at night, Monday through Friday, it transfers to the emergency room admitting
Oh,
from
okay, so your
11 at
staff
night
still
to
ans-
6 a.m. So
Okay.
they are still answering the switchboard,
Okay.
but it's just the emergency room staff.
Well, that makes sense, though, because the majority of the time.
That
once in a
department's
while there's-
24/7. It never closes
Right.
down. So.
And hopefully that time of the night, they're not real busy.
Yeah,
hopefully.
you don't really get a whole lot of calls for patients
Yeah.
at that time of night.
Yeah.
Things
yeah.
like that.
Okay,
Yeah.
well, that's pretty
So-
cool. And so what else? What else?
Well,
are you doing?
I do assist and oversee the registration departments that are non-direct report to me, which would be like physical therapy, imaging, radiology,
So pretty much
lab.
anytime you go in and they have papers that initial here, sign here.
Right. Those
that's
are all
your-
admitting registration
Oh, I
areas,
didn't
yes, ma'am.
Never thought of that
Yeah,
before,
they're
I guess.
all over the entire campus. Almost every department has its own respiratory,
Right.
cath lab.
Even
They
the
all have-
physician offices, I
Yes, the physician, well, I don't
Some of
really
them.
oversee the physician services offices,
Oh,
but
okay.
yes, when you go into a doctor's office,
Right.
that's what they're doing as well.
Yeah.
They're getting your insurance card and that demographic information to make
Right.
sure it's right.
Right, and those eventually, and we've talked about the whole electronic health record on the program
Yes.
before, and how eventually that the two, both outpatient and inpatient, will come together. in one
Absolutely. So
record.
if you see your doctor before you come into the hospital, the information will transfer over and vice versa.
Very cool. Well, we're going to take a quick break,
Okay.
and then we'll be back. We have some other things to talk about. So stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Susie Rhodes from Admitting. Thanks for being on the program again,
Thank
Susie.
you.
Every time I do this show,
Yeah.
I learn stuff myself. So it's really good that we educate our community about all these different things. We were talking during the break. Some other things I think is important that people know about. Number one, if they come in and they really would just like privacy, what do? If they don't want anybody to know that they're in the hospital?
Well, on the condition of admission form, which everyone signs when they come into the hospital, it will ask you if you'd like to opt out of the general census.
Okay.
And if you choose to do that, then when people call or you get flowers or balloons delivered, you're not here.
Right.
Which
so-
means you won't get those
No,
flowers
yeah, I
and
was gonna
balloons or
say,
phone calls.
yeah.
So it's a way to protect patients'
Privacy.
privacy if they choose to opt out.
Right.
We do try to explain to people, though, if you choose to opt out, it's all or nothing.
You can't say, I want flowers, but I don't want
Absolutely. I don't want balloons,
Yeah.
or I don't want,
visitors.
like I
but-
could say, I want Jamie to know I'm here, but I don't want somebody else to
Right.
know. It doesn't work that way.
Right.
It's like an all or nothing.
Sure.
But it is a way to protect your privacy. And then you do not show up in the general census,
And
which
what-
means nobody knows you're here except the clinical medical
Right,
staff.
and that means that it's not like, for instance, at the front desk with the volunteers. So like you said, if they come to deliver flowers or they get a call,
yes.
the switchboard, they look the patient's name up, oops, sorry, then, no record.
Well, we always use, regardless of whether you opt out or not, the secured census.
Oh,
So if you're not on that census, then
You're
you're
not
not here. If you're on the census, then you're here.
Here,
Then
right.
it's okay for me to tell somebody that you're
right,
here.
yeah, and that's
Yeah.
important that people know
It
that.
is.
And I know another thing you do at Admitting is talk to people about our smoking policy.
Absolutely.
Because it's important that people realize we are a non-smoking campus.
Yes.
Now, you wouldn't always guess that if you're walking by the healing cart.
Right? Yeah, oh yeah.
But we are a
Yeah.
non-smoking campus, including our parking lot. And
Absolutely.
I'm kind of the cigarette Nazi
Little-
because
yeah.
I'm walking back and forth all the time, and I'm always catching them out there and going, first of all, if you're supposed to be on the floor, you
Right.
should not be out here
You're
smoking.
smoking,
Does your nurse
absolutely.
know you're here?
Absolutely.
And we have patches available for the smokers, because I know I'm an ex-smoker myself. I know how hard it is.
It
But
is.
we do have the patches that the nurses can get for them.
And then in Admitting, we have little gift bags, I like to call them.
Yeah.
They have little hard candies in them. I think they're like cinnamon or
flavor,
cinnamon
supposed-
gum.
yeah.
And then there's a squishy ball.
Stress ball.
Stress
for-
ball.
Yeah, not for throwing. it's
Right,
for-
just for when
relieving
you feel
stress.
stressed,
Yep,
you can
yep.
hang on to it there. So we give those out, and we'll ask every patient, would you like to have one of these little bags? And for the most part, a lot of people do take them.
That's good. Yeah.
Yeah.
And it's still, like I said, I know I'm an ex-smoker, so I know how hard it is, but we do have those tools in place to help
We
them.
do. We do try to help them
Yeah.
on the floor and before they get to the floor when they're still in admitting.
Great. And then
We'll try to
another
educate.
thing that your department does is help folks, probably especially when they're coming in from the emergency room is when you see it the most, but they come in and they have no insurance.
Correct.
Self-pay, we call them, right?
Yes.
And so there's some options available for them that your department guides them on. What's that?
Absolutely. Well, first what we try to do is we have a couple staff that work for a company called First Source
Okay.
that are actually located in my admitting area.
Okay.
And that staff will review with them and see if we can get them on state access
Okay.
for Arizona.
Uh-huh.
They can also look to other states to see if they're covered under Medicaid somewhere else, or if they're traveling, if we
Oh,
can
from
get
a
them on
visitor.
Medicaid from
Okay.
another state.
Oh, so you can even help them with that if they're not from Arizona?
Absolutely,
Oh,
absolutely. And then from there, we can offer them the charity care for the hospital, which if you qualify by your income, of course, the hospital can help adjust some of that bill.
right, yeah. I think
by
we call it
helping you
qualifying discount program.
Yes, absolutely.
That helps
So we do have
that.
some ways to try to help people when they don't have medical insurance, or if they have a medical insurance with a big deductible.
High deductible,
Some of them
right.
have the $10,000 deductibles on them.
yeah.
Yeah, very expensive. They're affordable monthly or yearly,
Right.
but they're very expensive when you have to
Yeah.
use them. With
Well,
the
and of course, we've talked about before how healthcare, I mean, it is expensive. There's just no way around it. And it's one of those things, and usually, again, people are there for an emergency situation.
Absolutely.
And we're not going to turn them away. We
No.
give them the care, whatever it is that they need to get them well. That's our whole goal for being here. But it is expensive, so the more we can do to help them, obviously.
Absolutely, and we try to do what we can, you know, but absolutely they'll get their care first.
Right.
And then
right.
we'll see how we can assist them financially.
Good. That's
Yeah,
awesome.
on
Another
the
reason I'm proud of
backside.
KRMC.
Me too.
So what other things, we were talking about the PBX and the different admitting pieces of it. Is there anything else that we've forgotten?
Oh gosh, well,
'Cause I know you wear a lot of hats.
I try to think, well, like I said, we have an admitting registration area in almost every department. We have our new infusion therapy
Oh, that's right.
department now.
And is that part of your group as
That's
well?
not a direct report to me,
Okay.
but I have worked closely with them
Get them up
to
and
get them
running.
up and running and started for admitting. So we do have that new department added as well. I know when I have to try to think about all this, I'm like,
Oh, do I really do all that?
but it's just basically, we have services all over the entire campus, you
Now-
know, for just about anything you can want to come in
I just
for.
thought of something else that probably would be good for our audience to know about. What kind of information do they need when they come to the hospital?
Okay, well, if you're going to be admitted to the hospital, we need to have an order from your doctor.
Okay.
Now, some doctors, if you're in the physician, will hand it to the patient to bring over. If not, they'll fax them over.
Oh, so you know
So
ahead
we
of
know
time.
ahead of time. But when the patient's coming for the first time visit, you should have your information, your insurance cards especially. If you've never been here before, we really need that information.
Sure.
And then, of course, we'll get your demographics from you, your billing address, your phone number, your next of kin, who you want to call in an emergency, that
Right.
type of thing. But you really need your insurance card. So many patients show up and they're like, well, I have Blue Cross Blue Shield, but I don't have my card. Well, there's 50 states and a whole bunch of different Blue Cross Blue Shield
policies.
plans.
Yeah.
Yeah. So it really helps us if we have a copy of that card.
Okay.
And we actually scan it into the electronic medical record
Okay.
so that it stays on file until, of course, you change that insurance
Sure.
again.
Yeah. Well, that's good. So then you don't really have to have that every time,
No.
but especially your first
No.
time you need it.
But we will ask you for it
Mm-hmm.
every time. And what we're doing is just verifying that that information hasn't changed. I know sometimes patients look at us and say, well, I was just here last week and you guys asked me the same thing. It's just to make sure that we've got the accurate information.
Right. Yeah. Because people's things change.
Absolutely,
Anything happen
absolutely.
with us?
And also, I just thought of something, living wills. We also
I was just gonna
have
mention that,
the
yeah.
blank forms in admitting. You can come in and ask.
So even if you're not coming in right now, you're
Right.
not planning it, but it's everybody should have a living will.
Absolutely. It's got the durable power of attorney. It's got everything attached to it, and we can help you with it a little bit. We do have people in the hospital that can actually assist you with filling it out.
Okay, good.
If you need some instruction on it. But we do have that in the admitting area, so you can just swing by and pick it up during
then
business hours.
Doesn't the hospital keep a record? I mean, if you fill it all out, you bring it back to the hospital?
Yes, ma'am.
And they'll keep it
They
for
will
you.
scan it in medical records.
it's
Yes,
in
so
the
that it's
system for
on
you.
file. Yes, ma'am.
And that's really important. I
Yeah.
don't know if people truly realize that living will, what that, and I know neither of us is really an expert probably at it, but the importance of, so your family doesn't have to make some of those decisions. They know ahead of time what you want. right?
Absolutely, and it is, my husband and I, you know, we've worked here for 20 years.
Yeah, so you've
we
seen-
have the blank copies at home. We've never really filled them
I was
out.
just thinking
and
about that
one
I
of
have
these
to do
days,
that.
we really need to do that. And sometimes I think, I might think about, well, I'm not old enough to fill it, but truly we are.
Yep, we know it can happen just like that.
Absolutely,
unexpected, so.
and it is a comfort, I think, to have,
Yeah.
so that the family knows
Yep, what you want.
what you want.
Yeah.
It's already there.
Well,
it's
Susie, it was so great having you on
Well,
the
thank
show,
you,
and
Jean.
we always learn so much. So I hope you learned something today too, and join us next week because I'll have another great guest on the program for you.